So, welcome everybody. Hare Krishna. Thank you one more time for being with us this on Sundays and on our reading club. And if you want to share, I was seeing that it's nice to know where you are coming, where are you. So if you can put on the chat, it will be so nice. I will read the comments before we start because it's important also that. Batsala Asok is saying that Hare Krishna, everyone. Siama Manjari, she's saying Hare Krishna, dearest devotees from South Africa. Nice. Hare Krishna, Siama Manjari. Jivati Sundar is saying Hare Krishna to everybody, everyone. Siama Lota Devi Dasi, good morning, Hare Krishna from New Taliban, Mississippi. So yes, thank you everybody for being here. Remember, that it's so important that we have the opportunity to share with Sangita Mataji today. So we are going to use this moment to ask some questions. How are we, if we are reading this beautiful book? I know that we are new here, so we have some questions. It's important that we understand more and more, and we can, hopefully we can create more groups around the world of Vaishnava C.A.R.E. So thank you, Surit from Gainesville, Florida, and Shiris, it's from Winston-Salem. Thank you so much.
And
So
you're from our group in Philadelphia, and Dr. Greg in UK is here, and he's a nurse. And Shriji is here from North Carolina. She's an old friend, and I don't. And who else? Raise your hand if you want to talk about Karuna Shakti. Yes, is that my
Arvinda,
okay?
Arvinda Kaushik is from Warren, Ontario, also. Hare Krishna.
Jai.
So well, we can do this in order. So you can raise your hand. We have an option here on Zoom. You can raise your hand, and if you are not able to open your mic, or you can write the question, and I am going to read. So, who wants to be first? And I'm going to put here Sangita Mataji as a pin here like this. Okay, perfect. So,
And we have Greg and some other nurses on, I believe. So if anybody wants to add comments, even if you're not a nurse or medical professional, please add anything you'd like. Okay. You don't have to be
yeah.
a medical professional to have an opinion. Okay.
Yeah, you're free to share also. And just to make it more personal, I will put Sangita Mataji because later some devotees are going to be the recording videos. So whenever raise their hand, we'll put with. So you can do the question directly to Sangita Mataji, okay? So let me see if anybody raised their hand. Nobody yet.
No.
No questions? Okay, but Sala, one moment, please. Surit here. Okay, just one moment. Okay, you can do your question at Surit, please.
Do I go first?
Yeah, sure. No, who's okay, sorry, Surit first because you put the. Who wants to go first? Just please let me know.
You can let her go.
Okay, perfect. Then you go.
So who go? Oh, me?
You first.
Okay.
Thank you.
Okay, well, I have a little bit of complex. I'm curious if you had a situation with devotees that they weren't defined as like in their like final days. They were like some chronic sickness that they are home. They don't want to go to hospitals. They don't want to really, be even doing a lot of the examination stuff, like, doing the x-rays and stuff like that. And but they're home, but they're basically in bed all the time. And so I'm curious if you had such a situation, and then when it gets to a point when it's really, more closer to an end, as far as I understand, to get a home care, like a home hospice care, you have to be getting a doctor, right?
Can we turn off who's ever speaking and doesn't realize they're on speaker?
Please, can you mute yourself?
I think she did.
Oh, thank you.
I think she did.
Okay.
Yes, I'm just curious if you had such a situation, and then when and as I understand, you have to get the doctor diagnosis to kind of sign, so you'll be able to get a hospice, like a home hospice, to be able to get the medication just to maintain pain. How, if you had such a situation, and what really to do, how to deal with that, and how to deal with devotees that are in such a situation. If I don't know, if I hope I made it clear, but
So I think what you're saying is the devotee is terminally ill, they're at home, receiving care from family. Yes? Am
yes, I don't know if it's terminally ill because it's like wasn't really diagnosed exactly with, there are a bunch of things that's going on, but they're really can't like doesn't, not able to sleep, not able to eat much, not able to do a lot of things.
Right.
And
Do you, without saying the name of the person, do you know what the diagnosis is? Is it cancer? Is it heart disease?
so that's what I'm saying. There's no like clear diagnosis that they have things with, different things, like they have different breathing things that's going on, different, um, uh, what is it called, with digestive things that's going on, different, it's not like a clear diagnosis, like you can say they have a cancer or they have this,
Right.
and yeah.
Okay. Got it. Got it. So your question would be what?
So, but they've been already like kind of home. I won't say bedridden. They kind of still can function, go a little bit down sometimes, but they can't, go out much. They don't have energy like that. And they feel like, I mean, there were many times they were feeling like this is their last, days. So my question is how to deal with that, especially when it will come to a point, if it comes to a point that, and this has been going on for over a year already,
Oh,
if it comes to a point, and they've been going to some doctors, but whenever it's like they want to send them to more um, checkups and stuff, and these devotees that doesn't have insurance and like that, so they didn't really want to deal with that because they also don't want to get into hospitals, and kind of they prefer to just be home and leave their body home if they need to leave their body. And so my question is like, because at some point it will get, if it continue like that and it doesn't go any better, it will get to a point when it's come to close to an end. And that's when usually it needs like medications, like pain medications, to just kind of be able to keep them at a
okay.
certain level. So I guess my question, how would you, if you had any situation like that, and how you really deal with that, that's
Can you tell me what country this is in?
in America?
Oh, this
Yeah.
is America.
Yeah. Yeah.
State.
And here
What's
in Florida, and yeah.
in Alachua?
Yeah.
Okay, what I would do, there's a couple of, and one very, very friendly, devotee-friendly hospice down there. And I've met, when I went down to give a weekend seminar many years ago, the social worker from that hospice came to the seminar for the weekend and was very, very favorable to the devotees, and actually gave me a list of questions like, when do I take my shoes off? Where do I put my shoes?
Mm.
Tell me about your diet, your vegetarian diet. I mean, she was very, very favorable and really wanted to know about us. And this was years ago. So, the devotees there would know which hospice. I don't remember now. This
Yeah,
is
I think
a long.
probably, I mean, I think I know which one you referred, but I can ask Madhurya Lila, but what you were saying to check with them, or what, like what,
Yeah, yeah. What I would do, anybody that's friends with the patient or or the family, with their okay, I would ask them, is it okay if you call the hospice, ask if the nurse uh, um, or the doctor can come and make a visit and assess the patient to see if they would recommend the patient to be on hospice. and you know, just see if the patient can go on hospice for 6 months or so, and you know, see if that would be okay, if they would allow the patient to come on hospice. And yeah, just let them come over and assess the patient and see what they think. Okay, but don't do it, like I said, without the permission of the
Right.
patient or the
Yeah, of
family.
course.
Yeah.
Mhm.
Well, you know, you'd be surprised that devotees, you know,
Yeah.
guess what? You're having you know, they're coming over today and they're going to consult with you. You know, I mean, you'd be surprised. So always get the permission of the patient and the family, because
Yeah.
yeah, you'd be surprised. So, yeah, but I would definitely see if they would allow the hospice staff to, you know, the nurse to come over and see what they think. You know, they might accept this patient and see if he or she would qualify, and see if they can help to make them more comfortable. And maybe they would click, the nurse, the visiting nurse and or doctor, and the patient and family, see if it clicks. They
Mhm.
might be able to help, you know.
Okay. Yeah,
You,
thank you.
you
That's
know,
an idea. I didn't really
yeah, it
think,
could be,
but you
you
could
know,
coach them. Yeah.
yeah, you know, maybe they could give a diagnosis that would qualify them and make them more comfortable. You know, it could help. Just see if the patient agrees to it.
Okay. Well, yeah, that's a conversation that's need to kind of, because it's not like right at that point right now. But I was
Yeah,
just thinking about it since we are discussing, end of life here, and then the patient thinks that, a few times we're thinking it's, they want to live till the morning, then and already was deciding not wanting to go to the hospital and like that, and just want to, but yeah.
to the patient, it sounds like the patients are fully aware of what's happening, and
Yeah,
you know,
but
yeah, there's
I
no
mean, they
debate
get
about
days of confusion like that, but yeah, they know, right? It's not at the point where like just they're unconscious in bed and like that. But that's
it.
why I'm asking now, because I don't want it to get to that point, and then all of a sudden, oh, what are we doing when it's really, all of a sudden getting like shortness of breath so hard, and things like that that we don't know how to
Yeah,
deal with.
yeah, no, I think your thinking is right on track. You know, you want to get everything in a row and figure out what's going on and what you can do for comfort care. So I would talk to the patient and the family and see if they object to a visit from the hospice nurse, and see if they can do something for comfort, if they don't object.
Okay.
Okay. Some people hear the word hospice and it's like, whoa, you know, no,
Yeah.
thank you, not right now, you know, because hospice is, you know,
The
one and the
next.
same
Yeah.
with dying, you know, but, you know, it depends if they feel, if the hospice nurse can come, assess them, and then talk about what they can do to make them more comfortable if they need that.
Yeah. And I think some people also really don't get much the difference of a hospice from the hospital, from being in a hospital and all that kind of, yeah. So that
Yeah.
kind of scares the hospitals, definitely.
Yeah, give them the pros and cons of what it would be for them to be on the hospice program. You know, if the hospice would allow that at this point.
Right. Yeah.
Yeah, thank you so much.
Thank you.
Thank you, Suri. It was a great question. Actually, like we need to understand this point to not be invasive. And Greg has something, but Sada Ashok Mataji, I know that you are next, but Greg Luck wants to ask something related to this, so we're going to take this first, please.
Yeah, go ahead. Yeah, let
So
him go through.
so yeah, Greg, please.
Yeah, thank you so much, Hare Krishna Mataji and Hare Krishna fellow devotees. It was just an interesting question, and around hospice care, and we're obviously international. You know, there's people from the US. There are people from America, and I'm sure South Africa, and I think India as well, various different countries. So in relation to hospice care, obviously this might be different in different countries, and how this is provided. So certainly in the UK, a lot of the hospices are part funded by the government, but a lot of the funding comes from charity donations. So they have charity shops where they sell things and raise money for hospices, which pay for the nurses and pays for resources. So it's quite interesting, you know, how the discussion comes about if somebody may want some hospice care, whether that's in a physical building, at a hospice hospital environment, or whether it's hospice at home, which we have teams attached to the hospices in the UK where the nurses come out and see people in their own homes. So that would be something that we could refer to from our organisations to facilitate that. But it would just be interested to know if you know, in other countries, whether that's something that is quite freely available, or whether if like insurance is mentioned, I hear a lot you know, in relation to America. If people can't afford this, is this available to people? So more of a comment, but also a question about what other people experiences in their country in relation to hospice care.
Yeah. Um, most hospices in America have a fund for those who can't afford it. In America, we have what's called Medicare for the elderly. They pay into it with their job throughout their lives, you know, with their working life. And so every time they get a paycheck, some of it goes to paying into Medicare, which is the government insurance when they're older, when they reach 65, then it becomes their government medical insurance. Okay. And that pays for Medicare A, and there's Medicare B, C, G, Z. You know, it's a very complicated government insurance. Most private insurance that we pay for on our own covers hospice as well. So most do. So if you're fortunate enough to have your private insurance and government Medicare insurance, when you're older and you've paid into it your whole working life, then it'll be covered. It'll be paid for. Okay. If not, if you don't have this, then the most, and like I said, most hospices will have funding for those that can't afford it. So they do whatever they can in America to make sure that you can get on hospice and have it paid for. Does that answer?
Yes, that's yeah, that's a bit, yeah, a lot clearer. Yeah, wonderful. Thank
Okay.
you.
Yeah, they try their best, you know,
Mm,
to private pay for those that can't, that don't pay for it. They just don't have the money.
yeah,
So, yeah.
yeah,
And if
wonderful.
that particular facility doesn't have it, then they'll usually recommend you to call another hospice facility and
Mm,
get on there. You know, their free help, you know, for people who
yeah,
don't have the money.
wonderful.
Okay.
Oh, perfect. Thank you. Oh, sorry.
No, that I was just going to ask something, but I think you already answered it. So mostly hospice in the UK is paid for by the government. Hospice.
Yeah,
Yeah.
yeah. I mean, the hospices are part funded, but a lot of it is boosted by charity. They wouldn't be able to, with the money that the government give, it wouldn't be enough to keep it going. So yeah, I mean, obviously we have our national insurance that we pay into, which offers the free healthcare that we get through our lives. But hospices are wonderful in the sense that you know they're there for people that need it. If it's for symptom control or end of life care.
Yeah. Jai Cicely Saunders. She was a doctor who really is the godmother of hospice. She did so much to help push on the hospice movement. So in England,
Yeah.
Okay.
Wow.
So can everybody mute themselves, please? And thank you so, dear Mataji. Thank you so much, Greg. And Batsala Ashok Mataji has. We have many questions around the hospice, so I'm going to put here. I'm sorry.
that's all. Somebody's on.
Please accept my humble obeisances.
Please,
Mataji.
can you mute yourself? Okay, perfect. So dear Vatsala Ashok Mataji, if you can ask your question, please.
Vatsala.
Do I unmute?
No,
No, you. All the others, but not
you're
you.
already on. We can hear you.
Oh, yeah. One moment.
You can hear me, right?
Yeah,
Yes.
we can hear you.
Okay, thank you so much. My humble pranam to Sangita Mataji. Pranam to everybody. Okay, I have a question. I didn't even know what hospice care was till I met Sangita Mataji. So she was explaining a lot of things in Vaishnava's care. And also I got a question on Vaishnava's, palliative care and what it means, what is the difference? Somebody already asked that question. I wanted to know what stage or what point of life do we take the patient to hospice care and how long can they stay there in hospice care?
Okay, so first question was the difference between hospice care and palliative care, yes? Is that
Yes.
that was the first question? Okay, so Vatsala came last year to our Philadelphia temple and I gave a weekend seminar and I really appreciated her coming. She's on our Philadelphia Vaishnavas care team and she does a lot of service for the devotees here. So the difference between hospice care and palliative care is that I'm going to use myself as an example. I hate doing that, but I think it's easier this way. I'm on palliative care, okay, which is the basic meaning of that is pain and symptom management. Okay, so I'm on it because I'm diabetic for the past 25 years or so, and it's a very aggressive type diabetes. At the end stage of diabetes, diabetes is hospice appropriate. It will kill me. Okay, diabetes is a death sentence at the end stage. It's not right now. I'm living with it. It's being controlled with medication, with insulin. I inject insulin at night. I take insulin pills morning and night. It's being controlled by diet. I'm not very good at it, but it could be controlled with diet. So there's different ways that you can deal with your diabetes. It's and so I'm on palliative care where I have a palliative care doctor who who prescribes different medications, and I'm allergic to every pain medication there is, so he can't give me anything for pain, but he tries to, you know, he's just recently given me a prescription for acupuncture for the pain. Okay, so there's different complementary therapies I can take that for the diabetes. I have stage 3 kidney failure because of the diabetes. So so he's trying to keep me comfortable, okay, with the diabetes and kidney failure and all the other things that diabetes has done to my body. All right, it attacks everything in your body. It can attack every system in your body that has nerves. Everywhere in the body that has nerves, it's attacking my ears. So I'm going deaf. So I'm learning sign language. Okay. It can attack every system in your body, diabetes, where there's nerves. So we're just trying to control that as much as possible. So it's not killing me yet on hospice. Someday it will. But right now, I'm on palliative care where they're just trying to control the symptoms and the pain. Okay. Does that make sense? All right. It's not killing me yet, but at the end stage of diabetes and kidney failure, it will be a death sentence for me. And I will have to go on hospice. But right now, I'm on palliative care where they're just trying to keep the symptoms and pain under control. Okay, that's the difference between palliative care. You can live on palliative care for 20 years. You can live on palliative care for many years. Okay. Hospice care is more like you're given a diagnosis of an end stage illness, and you have a prognosis, meaning the doctor says this is about how long you're going to live with this disease. And it's usually that you need a prognosis, meaning this is how long you're most likely going to live with this disease. Okay. And you need, in America at least, you need a prognosis of 6 months or less. Okay. So I'm not given a prognosis of 6 months or less right now with diabetes and kidney failure. They said I can live a couple of years longer than that. I can live longer than that. So I'm not on hospice. They don't know when I'm going to die from it. So I'm on palliative care, meaning they just want to take care of my symptoms and pain management for right now. Make sense?
Thank you. Yes. Thank you very
does.
much.
Okay. If you have any other questions, ask it now, because I may not have explained it easy enough. Anybody else have a question about that?
Yeah, in case that Sala Shoko want to ask later, it's okay. If you don't have a question right now, it's okay.
That's how I think about it. And if any other question comes up, then ask it before we hang up. Or I'll see you later at the Sunday
Okay.
feast. You
Yeah.
can ask.
Thank you.
Okay.
And but by the way, was a great question to have to understand this difference between palliative care and hospice
Does
care.
anybody else have a question pertaining
Yeah,
to?
we have some questions here, and also Surit has her hand raised again. But I have some question on the chat, so I'm going to read it. We have a question from, let's see here, two questions actually. We have a question from Karuna Purna Shakti Devi Dasi. She's saying that will or are most hospice care facilities able to accommodate a vegetarian diet, including the no egg requirement?
Yes. Yeah. I've visited so many devotees at different hospice facilities, and also, I mean, they don't really cook for you when they come to your house unless there's no caregiver. And usually in the case of there's no caregiver at the home, then they'll make an arrangement for you to go into an inpatient hospice unit, and then they'll they'll make arrangements for you to have a vegetarian, but you have to be so careful. A few years ago, I was inpatient at a hospital near me, because of diabetes, okay? And they gave me a menu that said vegan/vegetarian. So I called down to the kitchen in the hospital and I said, is this vegetable soup? Are you sure that the broth is vegetarian or vegan? Are you sure? And they said, hold on, let me check. Comes back and tells me that the broth is made from beef, cows. And they had it on the vegan and vegetarian menu. So of course I freaked out, How could you say that it's vegan, when it's got cows in it? What's wrong with you people, And they had no explanation, but I learned real quick to ask about everything I ordered from that kitchen because they had no clue what they were doing, So be very careful. If you're volunteering for Vaishnava's Care on whatever team is in your area, and you go and visit somebody in the hospital or in an inpatient hospice unit, and oh yeah, they're providing me with this vegan vegetarian menu, make sure that you do them a favor and call down to the kitchen and make sure you ask about every ingredient, because sometimes they just don't get it, you know? So as a service to the devotee, ask what's in it. Okay.
Thank you. Thank you for that question. It's very important.
Yeah, very
Because we
important.
need to eat to still going with our health and treatment, right? But most of the hospital doesn't know.
It's better when we have a devotee in our community in a hospital or in a hospice unit that we bring prasadam, find out what that devotee can eat, what they can handle in the GI system, don't make it spicy, make it bland, find out what they want and bring it to them after it's been offered, because you just don't want to take a chance in one of those places, I believe it's in the Chaitanya Charitamrita where Prabhupada says, be careful what you eat on the airplane, in a hotel, and in a restaurant, but I would definitely add to that because of my own experience in a hospital. Definitely make sure you bring prasadam to the devotee patients, because you just don't know what they're putting in that. My vegan soup, thank
We
goodness.
need more Vaishnava's hospice, right?
Yes. Yeah, we have really good prasadam in Vrindavan at the Bhaktivedanta Hospice and Hospital. Really nice prasadam.
Jai, thank you so much, dear Sangita Mataji. We also have a question from Shamala Lota Devi Dasi, which I think was answered before. And but if you want to add something else, please let me know. She's saying, what is the difference between palliative care and hospice care? And thank you. So you already said that. I don't know if you want to add something related to that, or we go with the next with the next question.
Is there an added question to that? Question?
No, she made it. I guess she made it before you answered that. So I don't know if you want to add something else related to that, or we go on with the next question.
Yeah, if there's another question related to it, then I can answer. Otherwise, we've already gone.
Okay, perfect. Yeah, sure. So we have again Surit. So if you want unmute yourself and ask the question, please.
Yeah, just a quick question, and I hope it's not like a daily question. I don't have much experience with doctors, but it's like for palliative care, does it need a hospice doctor to give diagnosis, or this is any doctor you go can deal with that and give you?
Okay, if somebody's diagnosed and put on palliative care, That is totally separate from being on hospice, right? You
Right.
got that. So, a palliative care doctor is separate from a hospice doctor. There's a separate palliative care team, usually consists of a social worker, a palliative care doctor, and a nurse practitioner who has her master's degree in nursing and knows palliative care, comfort care. Okay,
So I consider specialist like that your doctor gonna send you to?
um,
Oh,
yeah, a palliative care I go to a palliative care doctor. My family doctor that my husband and I go to, he specializes in geriatrics, old people like us, and then also palliative care. So he specializes in pain and symptom management. And to give you an example, I'm allergic to most 99% of pain medicine. So I have pain for 30 years. I've been in pain. So with 16 operations on bones, mostly on spine. I've had 6 surgeries on my spine. So I was pain all the time for 3 decades. So I can't have anything for pain, like post-op, like after I have surgery, there's nothing they can give me for pain. So, they have to give me like physical therapy rather than pain pill. So I
mhm.
have to go to a physical therapist. He or she, shows me exercises, the stretching and different things that will help with pain because there's no pill that I can take because I'm very allergic to them. So, you have to just do what you can do when you're allergic to pain medicine.
Yeah.
You stretching, you do all kinds of stuff, physical therapy, acupuncture, you do alternative complementary therapies that can help with the pain because you can't take anything else. You think of any pain medicine that you've ever taken or that you've ever heard of, I can't take it. So, it makes life very difficult when you've been in pain for 30 years and you can't take anything for it. So you have a specialist, like you said, he or she specializes in palliative care. And it's not just for people who can't take pain medicine like me, but it's for people um, who need pain and symptom management for different reasons. It's not always because you're allergic to allopathic pain medicine. It
Mhm.
can be for many, many reasons. But I would suggest that you go to a palliative care doctor like I go to. And they're specialists in this field. Like my doctor, he knows what to do with me, which is, not every doctor would know what to do.
Yeah.
Here I am, I'm in pain for 30 years, and I've had all these surgeries on my spine and different bones. And he, I've been to so many doctors that get scared and they don't want me as a patient because they don't know what to do. But he's
Yeah.
totally fine with it because he specializes in it. Makes sense?
Yeah. Wow.
So always go to a doctor who knows what they're doing for you. Always.
Mhm.
Especially if you're in the US or in, England or, there's these things
Mhm.
are very new in India and different countries. Palliative care isn't heard of. When
Mm.
Giri Swami and I built the hospice in Vrindavan, there nobody had ever heard of it there. It was only heard of in Kerala, in very South India. Nobody ever heard of hospice in India when we went there to build it. It was quite yeah, it was difficult because even the doctors had never heard of hospice. They never heard of end-of-life care. So
Yeah.
we brought some of Radhanath Swami's disciple doctors to America, to California, and had them go to the San Diego hospice in California and get trained on how to
Mm.
take care of hospice patients. Yeah. Anything else?
Okay, no, thank you.
Thank you. Thank you so much, Sarit, for that question. It was great. And well, I was saying on the chat that we have time for one or two more questions. Anybody else wants to ask? And
Can I ask you one more, Vatsala?
yeah, sure.
Aribol, I was wondering, suppose if something happens to me, can I just shift over to Vrindavan, India to hospice care?
Yes.
Will they take me there?
Yes. And I'll help you get in. You know I would, Vatsala. Anybody here, I would, anybody anywhere, I would help get in. Yeah. Okay. A beautiful facility. Really nice. Big, huge rooms. You can have a friend come and help you.
Wow.
Okay. Has a big pull-out sofa bed so that you can have somebody come and stay in the room with you. It's a really nice place. Prashadam is wonderful. There's a nice temple room downstairs with Chota Krishna Balaram deities. And they go on their rolling altar and they take them around to everybody's room. So you can take darshan of Krishna Balaram.
So
Very-
what I understand is you can go from palliative care to hospice care there. Okay.
But they don't do palliative care there. It's strictly, well, they do. It's a hospital now. It was just a hospice. And now, since the COVID, they've made it into a hospital. They've made Varshana Eye Hospital, the Radhanath Swami's Eye Hospital. That became one floor, the top floor. So they
Mhm.
do, the cataract surgeries that they did in Varshana. Now they're doing it there in Vrindavan. The middle floor is the hospice floor. And then we now have an outpatient clinic, and we have an emergency room, and we still have outpatient van that goes to home visits. The doctor and the nurses go home visits, and we have a spiritual care counselor that goes and reads Bhagavatam to the patients and the family in their homes in different, outer villages in Vrindavan. And it's very nice, very sweet program. So, but yeah,
Thank you.
you
Thank
can
you.
be on palliative care here in America. They could come to your home and take care of you. And then when you're eligible for hospice care, we could get you to Vrindavan, and then you spend the remainder of your life in the Dham. And it's only about a 5-minute rickshaw ride, bicycle rickshaw ride from the hospice in Vrindavan to Krishna Balaram Mandir.
Wow.
Yeah. So you're right by the temple, right by our ISKCON temple in Vrindavan. We're just right up the road from the Krishna Balaram tree on the Parikram path.
Yeah.
Yeah. So the next time any of you are visiting Vrindavan, just go to the Bhaktivedanta Hospital and Hospice right on the Parikram path. It's a big saffron colored building. And visit it. Tell them that you would like to take a tour. It's very nice. Okay.
Thank you. Thank you, Mother Sangita.
Yeah, you would like it, Vatsala,
I will remove the pin.
for you to visit. Okay.
So, So some devotees are saying on our chat that they have to leave for some duties today, but so thank you so much, Sangita Mataji, and maybe we can send some information on our WhatsApp group of our reading club of our hospice in Brindavan. That will be nice. Thank you for
Yes.
that question, Vatsala Mataji was great. And thank you for being here, everybody. Remember that you always can follow us on Facebook. We are going to have another session maybe next year because we are just almost finishing to 2024. So hope you have enjoyed. And remember that we are having the next session with the the chapter 5, right? We are in the chapter 5 with the grief process, which is great. So don't lose the next session. And if you are if you have the opportunity, if you can open your camera, will be nice just to take a last picture and share in our group. So Sangita Mataji, thank you so much as always for being with us, and that was great, great information that you shared with us today. So, okay, I'm going to take the picture. Just one moment. Okay, 3, 2, 1. If you can put your camera. Okay, perfect.
Bye.
Jai. So, Hare Krishna. Anything else that you want to share, dear Sangita Mataji, with our reading club?
No, I just want to thank everybody for coming. I really do appreciate it. And we'll see you next Sunday. Yeah, next Sunday for the reading.
Yeah, next Sunday for chapter 5. Okay.
Yes.
Thank you, everybody. Hare Krishna.
Thank you, Sangita
Jai Shri
Mataji. Thank you,
Hare Krishna,
everybody.
Haribo.
Thank you, everybody. Thank
Thank you,
you,
Mataji.
Mother Sangita. Thank you, all the devotees.
Hare
Thank
Krishna. Thank you.
Hare Krishna.